So then you're going to have the patient hold like this, and then you're going to try to pull the head back the other way like this. Okay, so you're going to be pulling away, and you're going to have them put their head back towards the midline. But a lot of times you can just do the trapezius, but either way, you know, the trapezius is you have them shrug their shoulders, and you're pressing down, and the other one is you have them, you put them in the position where they're contracting that, and then you're going to try to pull it the other way. They're going to do that. Okay, so the ones we practiced already before is which cranial nerves? Did we do number one? And how did you do that? Okay. Did we do number two? What was that? Yeah, so it's either visual acuity or also visual fields. And did we do number three? And then what else did we do with number three?
4 and 6.
Yeah, 3 and 4 and 6 is basically tracking the eye movements, things like that. Okay, did we do 5? No. How are we going to do that? Is 5 trigeminal, is that sensory or motor? Okay, so how are we going to do the sensory part of this? Yeah. How many areas are you going to test?
3.
3 on one side or both sides? 3 on one side and 3 on the other. So it's divided into 3 different divisions. You got the upper division, is basically from the eyes up like this. You'll see a little bit of variations in some of the charts as far as if it comes down into here. But if you think of it as if the corner of the eye and up is the first, between the corner of the eye and the corner of the mouth is the second, or the maxillary, and then you have mandibular, which is down below. So you're going to do tests with like a piece of cotton or something like that, ask when they feel it, in 3 different areas. And then you're going to do things with either jaw reflex or muscles of mastication, so you're going to have them pull up and push down. Okay, so that's 6. I mean 5. Did we do 6 already? Yeah. Okay. And the jaw reflex. Also for 5, you could do the corneal reflex, where you're having them looking up like that. You pull this down, and then you test on the cornea, and you're going to look for both of the eyes to blink at the same time. Cornea is like the covering over the eye.
Make sure it's the cornea.
The conjunctive is the membrane that goes around the eye. So you want to be like right here, kind of on the edge. The cornea is what covers over the pupil here. You want to be like right on the edge of the pupil. And the conjunctiva is the membrane that covers the eyeball.
So we're just doing that for him.
Okay. So facial is basically going to be muscles of facial expression. Okay. And then you want to, again, kind of do it where you're having them wrinkling the forehead, things like that. So you're chesting in this area here, and then you're also doing something with the mouth smile or pointing the mouth down. Okay. Because if they can move their up above here, and they have problems down with the mouth, that's going to be more of an upper motor neuron lesion. Whereas if they have problems with both, if they can't wrinkle the forehead or move the mouth, then that's going to be more likely a lower motor neuron.
What if they've had like Botox or something? You know, they really can't actually.
Yeah,
Botox.
that's different. Yeah. It's paralyzing the
You
muscle.
think you can wrinkle your forehead?
Understand why, just the forming of the upper motor and both and the lower motor.
Let's see. For just the way that the wiring is, if it's coming from the brain, they're able to work this part and not the lower part. Whereas if it's a lower motor neuron, then it's affecting both. So then we get into the vestibulocochlear nerve. That's where you have 2 different parts. One has to do with equilibrium, and then the other one has to do with actual hearing itself. Right? So vestibular function, you're going to do things like the Rombergs. See that done either with the arms up like this or like this. sometimes with the head back or straight. You're watching for them to not be able to have problems with equilibrium. And then also though, you watch their gait. You can do heel to toe. But if you do something to heel to toe and somebody's had major problems with their gait or something, you may just send them to a neurologist, because you're not going to know if it's cerebellum problems or vestibular problems. This is kind of more or less just a way so that you can know, just to screen things out. Find out, yeah, is this a problem? Is this something that I'm going to deal with, or something that you're going to send to a neurologist? So then there's Romberg's, like I say, he starts out with the eyes open, and then they're going to close their eyes. So you're watching them to be moving and swinging a lot, or maybe falling over. And then again, to make it a little more difficult, we have them balance with their feet straight in front of each other versus side. I mean, obviously you're going to have a wider base of support if you're like this versus if you're doing this. And then, let's say the caloric test is they can put hot water or cold water in the ear. That's not something that you're going to be doing. And then we talked about the difference between conductive deafness and, let's see, conductive deafness is where somehow the sound is not getting from the outside into the cochlea, and that's where there's something on the more outside that's blocking. It could be buildup in the wax in the ear, problem with the tympanic membrane. But once you get it into the bone, like they may not be able to hear something out here, but if you're doing something like this and you're going right into the bone, then you know that the nerve's still working, it's just not getting to the nerve. Okay? Whereas if they have nerve or sensory problems, then there's something going on inside there where the nerve's not functioning. It doesn't matter if you get vibration to the outer part mechanism, it's not going to go through. So then we have this Weber's test. So you put the tuning fork on the top, and you're going to see if they hear it more on one side than the other. So I can hear it more over here. I guess we might have a hearing problem. So what was that somebody was saying over here? It's like, what if you're doing this class and then all of a sudden you found out you had a problem? It wouldn't be good. Okay. So basically you're looking for if they hear it equal in both ears when you put it on the top, and they should. So basically, normally the vibration through the air, you can hear that longer than you can through the bone. So you're doing this Rhines test, where you're putting it on here, and you say, tell me when you can't hear it anymore, and then you're going to get to the point where they can't hear it, and then you bring it over here and bring it close to the ear, then they should still be able to hear it. So that would be a normal finding. And then the other test is where you're just checking their ability to hear, where you're rubbing the fingers together and you say, tell me when you can't hear this anymore. And then you compare one side to the other. And then the vagus nerve is things where you can ask them to cough. Then you're also doing things where you're combining different nerves, where you're doing the gag reflex, swallowing, and then hypoglossal is the one that moves the tongue. So you're asking them to stick your tongue out and say ah. And when they say ah, you're looking for the back part of the throat to move up, and that's the vagus nerve because it's motor to the pharynx and larynx. And you're looking for normal, straightforward deviation, normal straight movement of the tongue. If you have a hypoglossal problem, the tongue is not working well on one side, so it's going to move towards that side because the muscles are pulling it, pushing it out, so it'll deviate towards the side that has the weakness. And then spinal accessory, you just have them shrug their shoulders like that, or you do the SCM test. Okay? So then let's practice those. What, 45 minutes to practice those, so we should be able to do that. And then we can review them all again next time. Okay?